CBS 17 is your local election headquarters, and as part of our political pledge, we are talking about the issues you told us matter the most when you head to the voting booth. Tonight, a look at access to health care and one woman's mission to improve it. Just 6 months ago, the lights were off, the building was empty, there was no one to check you in, no one to test you for the flu. The former free clinic in Warrenton had been closed for years, but then Dr. Damara Russell came home.
Honestly, when I started deciding that I wanted to go to medical school, I always knew I kind of wanted to come back home.
17 North Carolina counties do not have a hospital, and that includes Warren County, where Dr. Russell is now one of only a few physicians for the whole population.
I think that the barrier of not being in a community that has a lot of access is definitely part of the problem.
A problem that means patients have to go to a neighboring county for a trip to the emergency room or a hospital stay, which can add to overcrowding. Russell is trying to ease that.
I think that says a lot about her to have come here.
Bashelia Copeland is one of Dr. Russell's new patients.
Not being able to easily get somewhere can, easily make a person's decision of whether or not they even seek treatment.
Russell says the lack of easy access to health care means in the long run, insurance companies and taxpayers pay more, and the whole community suffers. The clinic sees a lot of new patients with advanced diabetes and cardiovascular disease.
That is the key to healthcare. If we can get everybody to understand that preventative care is the way to go for healthcare management, because if we can manage problems before they actually become problems, then it's a lot easier than trying to provide care after the fact.
The need is so great that the county agreed to lease the building to Hope Regional Medical Clinic for only $1 a month.
So it can be a big difference in going here as opposed to having to go to Henderson or even Raleigh or Durham to see a doctor.
I feel like everybody deserves to live a healthy life. And if they don't have access to health care, how can they do that?
She's remarkable.
She's a remarkable woman, an incredible staff. And, one of the things people might not even think about, if you've got to drive an extra 30, 45 minutes, that's gas.
Yeah.
And if you're on a low income.
And time.
Exactly.
I get that.
As one said, I'm on my lunch break today. I couldn't go another hour away and be on my lunch break to do it.
Unbelievable.
Yeah.